and good morning everyone. Welcome to our presentation video by Group 4. First of all, let me start by introducing our 4 group members. The member of presenters involving Kristi Uyang John, Nur Diana binti Mat Hassan, Anis Farzana binti Ahmad Jamaidi, and Nur Farahani binti Abdurrahman.
Hello everyone, I'm Nur Diana. So let me brief you regarding MOH. What is MOH? MOH is stand for Ministry of Health owned by the Government of Malaysia. As you can see in the slide, there is the Ministry of Health logo that include of their motto and core values. The motto of Kami Sedia Membantu and the values of loving, professionalism and teamwork have been the principles for their agency to keep on going towards their vision, mission and objective. Before that, the government of Malaysia having Ministry of Health in order to take in charge for the health system of the country to achieve the standard level. Here is the vision and mission of MOH. A nation working together for better health is known as the vision, and the mission is to lead and work in partnership in order to facilitate and support the people to attain fully their potential in health, appreciate health as a valuable asset, take individual responsibility and positive action for their health. Not only that, the mission is to ensure a high-quality health system that is customer-centered, equitable, affordable, efficient, technologically appropriate, environmentally adaptable, and innovative. More than that, with an emphasis on professionalism, caring, and teamwork value, respect for human dignity, as well as community participation. The objective of the Ministry of Health Malaysia is to assist an individual in achieving and sustaining as well as maintaining a certain level of health status to further facilitate them in leading a productive lifestyle economically and socially. This could be materialized by introducing or providing a promotional and preventive approach other than efficient treatment and rehabilitation services, which is suitable and effective, whilst priorities on the less fortunate groups.
As we know, YB Khairi Jamaluddin and Dr. Nur Hisham are the 2 powerful people involved in the Ministry of Health Malaysia.
The functions of MOH is improve and maintain the quality of health by providing efficient and effective health services. As we know, community more prefer private hospital more than government hospital because of their services. Next, as informants of the birth and death occurrence. MOH is all-in-one, which is since our life were relatable with the agency, start from the beginning of the birth to the end of the life. Health informations records collected in every health facility are important for statistical analysis. Health information record is vital for health specialists in diagnosing their patients' health progress from time to time.
The responsibility of MOH include ensuring the quality and access to healthcare service. For instance, MOH is one of the Malaysian government that involved in the MySejahtera system application. The community can easily update health status and keep in touch with the latest info. MOH also providing online service for communities' convenience so that they can easily access for any question or complaints regarding health issue. Secondly, MOH also take responsibility in joining hand with MITI and MKN for the country's economic strength during COVID-19 pandemic. For instance, MOH creates collaboration between Malaysian international trade and industry regarding standard operating procedure. Furthermore, collaboration between MOH and MKN by spreading safety awareness through SMS. MOH responsible for giving treatment on the communicable disease and non-communicable disease. Communicable disease is the type of infectious disease such as COVID-19, HIV and tuberculosis. This type of disease might need special treatment and requiring special while handling the patient. Non-communicable disease is the type of non-infectious disease such as cardiovascular, cancer, and diabetes. Even so, this type of disease might need repeated appointments in order to monitor the patient's health status.
Authority. So, what is authority? Authority can be used to protect our rights to life, liberty, and property. Hence, it is used to provide order and security in people's lives. The first point is MOH has the authority in monitoring health and cosmetic products in the marketplace from the manufacturing process until the supply process. MOH has the authority to give recognition or approval to health and beauty products before they are marketed. MOH also has the power to withdraw the approval given if it's found that the product sold contains dangerous substances. Furthermore, MOH has the authority to set standard operating procedure, which is SOP, in order to control the spread of infectious disease such as COVID-19. The authorities impose a compound on anyone who fails to comply with the prescribed SOPs, not wearing face masks, failing to maintain physical imprisonment, and not registering Truth My Sejahtera application or recording personal details when entering the premises, which will incur a compound of 1,500 ringgit Malaysia. The last point is MOH has the power to require food product operators to undergo food handler training courses, which is LPM. This action is to prevent and control food poisoning diseases caused by the failure of the food premises to maintain hygiene and ethics in food management. These are a few an example of a certificate provided by the Ministry of Health, MOH, based on the field observation made at each food establishment, such as a cafeteria. According to hygiene, the food hygiene is rating certificate has 4 grades, which is A, B, C, and D. The A grades represent for excellent, while D is very terrible. Here is an example of how to break the COVID-19 chain by avoiding crowded places, confined spaces, and close conversation. Society should have followed the 3W rule, which is wash hands with soap, wear a face mask, and warn. Furthermore, through the registration and licensing system, consumers may always verify their products to ensure the quality, efficiency, and safety of their pharmaceuticals. There are also Malaysia law regarding the prevention and control of infectious disease.
MOH is one of the government agencies that successfully applying an ethical principles while performing their duties. MOH is caring by providing services in fully responsive, friendly, and courteous. In terms of professionalism, MOH provide the best services include ethics and standard of work, as well as the principle of responsible personnel as required, willing to meet expectations of society. And as for the teamwork, MOH is working as one team to achieve the same goal.